COVID-19 pandemic is the defining global health crisis of our time, with devastating social, economic, and political consequences worldwide, as well as a tragic loss of life. As a central actor in the UN development system, the UNDP is playing an important role in shaping and driving the UN response to the crisis. In the health sector, UNDP's COVID response has included procuring much-needed medical supplies, strengthening health infrastructure, managing health waste, quickly leveraging digital technologies, and ensuring health workers are paid. To support the UNDP response to COVID-19 in the health sector, the Independent Evaluation Office extracted lessons from past evaluations of UNDP's work. There are several lessons that this paper brings to light that can help UNDP prepare for, respond to, and recover from the COVID-19 pandemic. Through our review of past evaluations, we identified 9 lessons, and the first one I would like to mention is the importance of focusing on local health services to reduce barriers to access for women. Health crises hit women especially hard. The Ebola crisis, for example, affected women in particular as they played the role of health workers, caregivers, and heads of household. In health crises, women often take on unpaid caregiver roles at the expense of their own careers and personal well-being, with impacts on family and local economies. Barriers to gender equality exist in the health sector. Evaluations have shown that strengthening local health clinics, promoting engagement of female health workers and volunteers, and ensuring communication strategies use inclusive language and address stereotypes, stigma, and sociocultural patterns have helped women access health services. Another lesson is ensuring that health workers are paid in time expands care. This is fairly intuitive, but perhaps less immediately obvious is that paying health workers also has positive effects on local economies and access to financial services. For example, in Zimbabwe, their harmonized health worker retention scheme reduced vacancies and allowed expansion of care. The digitized payment system used in Zimbabwe also had the unintended benefit of bringing health workers into the formal banking system. Receiving payments required them to open bank accounts. This suggests significant potential to coordinate new interventions to ensure health workers are paid with existing programs on inclusive finance and mobile money. One of the challenges in identifying lessons for COVID, and what made this exercise really interesting to carry out, is that it wasn't enough to look for evaluations in the health sector or linked to Sustainable Development Goal number 3. We started by searching evaluations covering interventions in the health sector and found quite a bit related to UNDP's experience with the fight against AIDS, tuberculosis, and malaria. However, we wanted to know if there were other experiences relating to other areas of UNDP's COVID response offer. So after our initial keyword searches, we continued to delve into the database using other keywords. In other cases, we heard of or we read about some work that UNDP had done in a country, and then we looked to see if we could find evidence or lessons in evaluations from that country. Our research was thus an iterative process. This actually reflects one of the lessons included in the paper, that strengthening health infrastructure has multiple entry points. We found results for the health sector and evaluations of interventions focusing on the fight against corruption, on improved service delivery, on community development, and even access to information using new technologies. The message here is that UNDP can respond to COVID from multiple angles, through its poverty reduction and inclusive finance programs, through governance initiatives, as well as through support directly.